is somebody who has been a candidate for public office, I believe, and has been a great activist as a private citizen, has worked on health care for a long time in many capacities, has had the ear of the president, and helped with testifying before the president and I think Congress, helped establish the universal caps, the ban on lifetime caps as part of the Affordable Care Act, and is president of Healthcare for All Colorado now. And I should say, by disclosure, that TR and Nathan and Irene have all worked together in the past on various approaches to solving this solution, and all chipped in to help when she was first launching the idea of the cooperative. But Nathan is one of those who have taken the reins of Healthcare for All Colorado, which Senator Aguilar ran previously, and is a great proponent for universal health care, so can give us a little bit of an idea of what a path to universal health care in Colorado could look like. Is that
Sure. Thank you, Owen. Just full disclosure, as Lindy said, I also serve on the exchange board, so had I gone first, I would have said, any exchange questions?
Just point at each other.
I also serve on the All-Payer Claims Database Advisory Committee, which is kind of a wonky group of people that's actually taking all the claims data from all the payers and consolidating them in a database and running analytics on them and giving us a very, there are other states that are doing it, but none so well and so robustly as Colorado, giving us the data that we need to look at what healthcare costs really mean in Colorado, both from a consumer standpoint and also a public health and policy making standpoint. But I will speak from the my seat as president of Healthcare for All Colorado. We're an organization that dates back. I'm going to forget the year. When did we start? 2000. Okay, so we've been around almost 15 years now, focused on single-payer healthcare, single-payer universal healthcare. Single-payer, the term gets thrown around a lot, gets meaning a lot, but really what we're talking about is a single risk pool, a single pipeline of money that enables us to then cover every citizen, as all of the other industrialized democracies do. So I'll say, there's no denying that our current system is fragmented and fractured, and there's a lot of work to be done. We're twice as expensive as all these other countries, and we have yet to come close to covering everybody. We've got 1/6 of our population is not covered at all. We've got at least another 1/6 of our population that is underinsured, which means that they can't afford the care that they need. The high deductibles that we're seeing growing serve as a barrier to care. So what we're looking at is ways to fix the financing of healthcare so that everybody can get covered and not have those barriers. We look at other countries, and all these other countries, they all profess that healthcare is a human right. They all say that the financing of healthcare should not be profit-driven, and they all centrally manage costs through the things that we argue about in this country. Getting Medicare to do bulk purchasing and negotiation for drug prices, which we can't do. Other countries, they say this is the price for the drug and this is the price for this procedure, and everybody pays that, whether they're a pure single-payer system or nationalized health care or even a multi-payer system. They all agree on a price. Here we don't do that. It's so fragmented. Everybody pays something different, and nobody knows what bill they're going to get at the end of the day. Last year we started a citizens initiative campaign that really just boiled it down simply to the human right to health care. That if we could get this passed, then that would basically give our the legislature basically the citizen mandate to say, okay, the citizens want universal health care, let's make this happen. Very similar to how the whole marijuana thing happened, right? So they were given kind of the mandate to make it happen, and they made it happen. It was kind of an experiment for us because we had never run a citizens initiative before. We learned a lot. We got what we found was that there was phenomenal support for it. We did not do paid canvassers, paid signature gatherers, so we were limited in our ability to gather by the size of our volunteers. But we got, tens of thousands of names of people that wanted to see this happen. So we're looking at doing something like that again. Focusing again, like I said, on the human rights aspect. A couple of interesting things is that I wanted to point out. We see access to healthcare as a nonpartisan issue. We saw the Obamacare fight; it was very politicized. But in reality, everybody gets sick at some point. Everybody needs healthcare at some point. It doesn't matter whether you're Republican or Democratic or Libertarian or some kind of anarchist or whatever. You're going to need healthcare at some point. So it's best to look at the concept of insurance. Insurance is all about risk pooling, and the best way to do insurance is to pool everybody together. So if we have 300 million people all in the same pool, then we wouldn't have to, we could manage the cost more effectively. We could deal with actual healthcare issues. And public financing healthcare is actually an American ideal too. We provide various types of public health programs. We've got elderly covered through Medicare, the poor covered through Medicaid, children through SCHIP, military through TRICARE, Native Americans through Indian Health Service. We offer huge tax incentives to employers to cover their employees. And now we're providing subsidies to individuals to get private insurance through exchanges. All of this is public money. And because of the fragmentation, the amount of public money we're pumping into the system exceeds total monies per capita in all these other countries. So we're already paying for a system that everybody else is enjoying, and we're not getting it. Even in 1948, after 2 years of drafting the Universal Declaration of Human Rights, the UN adopted Article 25, basically said, among other things, that one of the universal human rights is the right to health care. And that article was put forth by the United States delegation, led by Eleanor Roosevelt. So again, dating back to 1948, this is an American ideal. This is something when you look to Canada, when Canada went to Canadian Medicare. Saskatchewan is where it started, one of these province models. Saskatchewan, very similar to Colorado, not very well, it's kind of sparsely populated mountain province. But we had missed the boat. We had missed the opportunity to do universal health care at the time, and Tommy Douglas in Saskatchewan, they pulled the people that were working on the United States to come up to Canada and help them figure it out. So they implemented what we missed the boat on at the time. Even you look as recently as the Iraqi war, and when we rewrote the Iraqi Constitution, we put in the Iraqi Constitution the right to health care. So this is not something that's foreign to America, other than the fact that we don't have it for ourselves yet. Anyway, so the system we have is kind of an accident of history. It goes back to the wage freezes in World War II, and employers were looking for ways to give additional incentives to employees, and they started paying for health insurance because at the time it didn't cost very much. That system kind of stuck, and costs have exploded since then. But there's no logical reason for employers to be in the middle of the system, picking insurance plans for their employees. A lot of times they don't know what medical issues their employees have, yet that's what we're stuck with. And there's also no reality where families know what their health care needs are going to be for the coming